Yeah, great question. So with lasers this time of year, we're oftentimes treating sun damage, just signs of overall a little bit too much sun in the summer months, brown spots, red spots, and uneven texture. So this time's a great time of year to do everything when we can get some optimal results.
Majority of the time we like to do our lasers in the winter months because we know that we like to avoid as much sun exposure as possible before and after our laser treatments. And then we can really maximize our results knowing that we're treating the pigment that's most prominent and people are most concerned about without having the risk of the sun being a factor.
A lot of people ask what the benefits are for lasers, and lasers are really something that you want to think about as a long-term treatment. So one laser is probably not going to give you a ton of benefits, but over time we found that doing multiple lasers, usually or typically like 4 to 6 weeks apart, can help with numerous things such as rosacea, brown spots, sun damage. They can help just overall collagen production, so using them over time will help to keep your skin nice and healthy.
Yeah, downtime can vary a little bit based on the device that we use. Typically, if we're using more of like a device for treating reds and browns, we can see a temporary increase in that pigment in the process of getting it to fade. So just a little bit of an increase in redness initially after treatment, and potentially some of those browns might be a little bit darker before they fade. So we can see that little bit of pigment difference to the skin for a few days, and potentially a little puffiness to the under eye area. Other times, if we're trying to be a little more corrective in terms of texture and lines, we could see potentially just more swelling in the treatment areas.